Newton-Wellesley should be extremely proud of how we've done. Who wouldn't like to get straight A's, right? Isn't that what we're all taught to get, a straight A's? So, it's important for our patients to recognize that our commitment to patient safety, because you come in here and you know you're going to get a world-class experience.
We're staffed with people that are well-versed in patient safety. We have registered nurses, we have licensed practical nurses. Most of the people here have worked in ERs before, are emergency trained.
We are always looking out for safety concerns that may cause undue accidental injuries, such as a ripped rug in the hallway that could trip somebody, a pothole in the parking lot, or any kind of unnecessary safety concern.
At our monthly business meetings, we do go over any safety reports that we've seen. Safety is a big role in kind of all of healthcare, and so we're working really hard to make sure that that's our #1 thing, that patients are safe.
Our department has a unique role of a mix of talents between nursing and quality, and together as a team, we drive at improving patient care.
Some of the ways we contribute to patient safety is by utilizing the tracking system that we have, so we know where each patient is at all times when they're here for surgery. We have a real handle of where our patients are. In addition to that, nurses can institute what's called a fall risk protocol, which would be carried out by anyone coming in contact with that patient throughout their stay here.
As a physical therapist in cardiac rehab, we definitely screen for safety in and around falls. So when we meet a new patient, we do a balance assessment. We have them stand on one foot. We have them sit and stand from a chair. We watch for any issues around that beyond the traditional medications and other questions that are asked.
So our job is to improve their strength and mobility. In order to do that, we want to make sure that's safe, and we always, if needed, have a wheelchair close by when we're moving and walking the patients to make sure that the patient is safe.
As a social worker and our nurse case managers, we can spend a little more time chatting with them, getting to know them. We coordinate with the families and the patients, so it's a more of a collaborative approach. I think the patients really do appreciate that attention.
The way we contribute to patient safety is now we have an incubator that reads within an hour. Before we had a 4-hour read, so the surgeon, whoever needs that instrument, can get it a lot faster.
Part of providing quality care, because we're keeping up to date with all the new regulations, new laws, new images.
Quality means providing the best level of care that I can. I think my patients and my patients' parents come in expecting the best care for their son or daughter. And it is my job to make sure I not only meet their expectations, but find some way to exceed that. And if that's exceeding it by reaching a goal or a benchmark earlier than I can, or just finding some way to support to make their day a little bit easier, and to make the parents' day a little bit easier, or make the child's day a little bit happier or brighter. That's big for kids.
That's our goal here at Newton-Wellesley, is trying to establish where we are and seeing if we can get from good to great, from better to best.